Identifying a person at the early stages of cancer is very important because that is the stage when we can actually cure patients. By cure, I mean that we can totally cure them of the disease and prevent them from having the disease coming back at any stage. Seeing them at an early stage means that patients who come with early lumps, very small ulcers, which have not spread to other parts of the body or to the adjacent organs from the organ which it is arised from. So that is the importance of finding a person at their early stage, because only at identifying at these stages we can actually cure them. That is where today we have screening modalities like asking all women to undergo mammograms, pap smears, men to undergo ultrasound of the abdomen and PSA tests. Because by identifying these, we can identify tumors in their stages 1 when we can easily cure them and offer the patient a chance of a higher range of cure with less toxic treatments. Identifying a cancer in stage 1 is potentially curable, and cancers in certain stages 2 and stage 3 are also potentially curable but may require more aggressive treatments. Usually stage 4 cancers or the last stage cancers where they have spread to other parts of the body, those are not curable. Usually stages in cancer stages 1 and 2 are easily curable, while stage cancer 3 is usually not so easily amenable to cancer. Coming to the treatment of cancer, there are 3 main modalities of treatment or management of all forms of cancer. The first one is surgery, which involves operating and removing the cancer or the tumor cells with the organ which is involved. So that is surgery. Surgery usually is curable in early stages, and is usually added on with other forms of treatment to treat cancers. The next form of treatment is radiotherapy, where radiation therapy or using rays, which are electromagnetic, these are used to kill the cancer cells directed at them. So the radiation is also used as a localized therapy and can be used in stages 1 to stage 3. Usually surgery and radiotherapy are called local modalities because they affect only the part of the cancer which is affected by the organ which is affected by the cancer. Then the third form of treatment is chemotherapy, which treats cancer by administering drugs into the bloodstream, which then go ahead and kill the cancer cells. Chemotherapy is called a systemic therapy because it is administered in the bloodstream and it goes and affects the cancer cells throughout the body. Usually chemotherapy is the only treatment which is offerable in stages 4, but it can be used as an adjunct in stages 2 and 3, where it can prevent the cancers from coming back early. So basically there are 3 forms of therapy, that is surgery, radiotherapy and chemotherapy. Cancer treatments are today very well known because of their potential side effects and the adverse effects which are occurring because of them. Coming to the adverse effects or the side effects of each form of therapy. First is surgery. Surgery, treatment of cancer, involves removal of the organ which is affected by the cancer. And the problem which arises from that is removal of that organ can cause a lot of physical and the psychological effects. Like for example, removal of part of the tongue, removal of the breast, removal of organ like the stomach can cause problems which can occur because of removal of the stomach or the breast, and these are the side effects of the surgery. Surgery also has the side effects due to anesthesia, and like any other surgery there can be bleeding, infection and other potential side effects. Coming to the side effects of radiotherapy. Radiotherapy, because it involves radiation to the cancer cells, it also causes radiation to the adjacent organs or the parts around the cancer, and these can cause side effects. And the radiation side effects can be early, that can occur during the radiation therapy, and they may occur even very delayed, that is occurring up to 5 years after the treatment of the cancer. Chemotherapy also causes side effects in the way that chemotherapy kills cancer cells and also kills all rapidly growing or proliferating cells in our human body. So when chemotherapy is administered, all fast growing cells like skin cells, cells which cause the hair to grow, cells in our mucosa, that is the lining of the alimentary canal, cells of the bone marrow, all these cells are also affected along with the cancer cells. So the side effects can be potentially toxic, like hair fall. The patient can have severe nausea, vomiting and diarrhea, and they can also have severe depression of their blood cells because the bone marrow cells which produce the blood are also affected by the chemotherapy. So these are the potential side effects of all cancer chemotherapy and the other forms of treatment of cancer. But this is still a small price to pay for affecting a good cure in such a major disease as cancer. So how does chemotherapy work? Chemotherapy is basically a drug which is injected into the blood and causes death of all rapidly proliferating cells or very fastly growing cells in our body, because the cancer is at present the fastest growing cell inside the body of the patient. But the problem is that it also affects other cells which are equally growing, maybe at a slightly lesser rate, like the skin and the alimentary tract. So chemotherapy basically affects by killing the cells which are present throughout the body, and also the cells which are present inside the tumor and the cancer cells which have spread to other parts of the body as well. But somehow the cancer stem cells which are present deep inside the tumor are the ones which are the most resistant to the chemotherapy. That is why chemotherapy is not given in one single shot, but given in recurrent cycles, such that the cells which are killed and the cells which are almost killed and tend to regrow are affected again and again and again. That is why you must have heard that chemotherapy is given in recurrent cycles, where a patient is given drugs once in 21 days for at least 6 times or 8 times or even more, so that all traces of cancer can be wiped out from his body. The commonest question that all patients, and more than the patients, the family of the patients ask the cancer doctor is cancer hereditary? As of today, we know that 15% of the cancers that we treat today are hereditary. That is, these are caused by genes which are passed on through generations. But unfortunately, we still have identified only very few genes which are the actual causative agents for these cancers. Some cancers where we know have a very strong predilection or a genetic predilection or a hereditary predilection include breast cancers, ovarian cancers, uterine cancers, and certain stomach cancers and colonic cancers. So these cancers are spread because of heritable or inherited genes. We usually, when we treat a patient, the first thing that we ask them is a family history and identify something called the pedigree chart. And if the family has got a high risk of cancers within their first and second generation members, then we usually take them up for counseling and ask them to go for genetic testing to identify whether they have any of the identified genes which are causing these cancers. It is only when you have 100% surety that these patients have got an identifiable gene can we then go ahead and identify the gene in all other members of the family and make sure that they do not possess the gene, and if they do so, we today have many preventable modalities, either in the form of drugs or preventive surgeries, to prevent the occurrence of cancer in those members who have inherited the genes in the family as well. However, what is most important to remember is that these are inherited only in a genetic lineage, that is from the mother to the daughter to her daughter, or grandmother, aunts, and there is no chance of it being either contacted through touch or because of any other contamination. One of the biggest problems with cancer today is that the treatment is not stopping with just the treatment per se. The problem that we see is that many patients tend to come back with the cancer even quite some time after they have completed the treatment for the cancer, and we have thought that we have cured the cancer. This may be as early as within a few months after the treatment to as late as many years after the treatment. Why does this happen? This happens because cancer, we know that there are some cells which are deep inside the body which remain, which are called the cancer stem cells, which remain despite all the treatments, and these can manifest at a later date after the treatment as a recurrence or spread to other parts of the body. The commonest problem that we see, let me tell you, is that a person who's got a breast cancer has undergone surgery, possibly chemotherapy and radiation therapy, and we feel after all the scans and the examinations that there is no cancer left in the body. The patient goes around, she is fine, but after 2 years, she suddenly comes back with disease in her lungs. So this is called a recurrent cancer. This is unfortunately still seen in many cancers today, and that is why we advise all patients who have completed treatment and who we have cured with cancer to still be on something called a strict follow-up or a surveillance for a period of at least 5 years after they have completed their treatment. This period is when the doctor examines them. Also, we may order some tests and scans to identify that there is no recurrence, and if there is a recurrence, to identify it early so that we may then still offer them treatment with a chance of cure all over again. What can we do and what do we not do to prevent cancer from happening to all of us? This is the commonest question which arises in all our mind, and frankly speaking is still there even in my mind. The most important thing that we can do, we can avoid a lot of things to avoid cancer, because we know that these things are proven to cause cancer in many people. The first thing is avoiding tobacco. Avoid tobacco in any forms and all forms, like smoking, chewing tobacco, or using snuff, because we know that most of these are carcinogenic and they cause cancer in most patients. The second thing is avoiding alcohol or drinking alcohol excessively. The third thing is avoiding excessive exposure to pollutants and to pollution. It may be inevitable in some people because they are working in polluted environments or because of industrial pollution. But in these people, they will have to take the precautions like using extra dense or N95 masks to prevent the pollutants from entering into their system and making sure they are not exposed to them. And also using other barriers, like those in the paint industry should use extra thick leather gloves, extra thick foot gear to prevent their skin in coming contact to the paints and other carcinogens which they are exposed to. The third thing which we should not do is avoid high fat, high caloric diet, because today we have definite proof that a high caloric, high fat diet can lead to certain cancers like cancer of the breast, cancer of the large intestine or the colon, and cancer of the prostate. So how do we avoid high fat, high density food? Is that we go back to our protein Indian diet where we have lot of fiber, lot of cereals, and avoid dense materials like milk products, non-vegetarian food, and fat dense processed meats and other foods. Then what are the do's that you can do to avoid getting a cancer? The first thing is a healthy lifestyle, which includes a good stress-free balance of exercise and low-fat, low-calorie diet. So how do you exercise? It doesn't mean that you have to have vigorous exercise. It just includes around half an hour to 40 minutes of exercise at least 3 times a week. This could be just a stroll or a casual walk, or it could be a run, or it could be any sport that is played, and avoiding a sedentary lifestyle and sitting inside one room exposed to the same carcinogens repeatedly can definitely prevent cancers.